everyone, today we're going to be talking about obstructive sleep apnea. The learning objectives are to be able to describe what obstructive sleep apnea is, to know the basic symptoms and risks, and also to know the main treatments. So, sleep apnea, or OSA, is a very common sleeping disorder, and there is obstruction to the airway. So an apnea is a cyclical pause in breathing rhythm, and then a hypopnea is sustained reductions in the breath amplitude. These apneas and hypopneas are specific to the sleeping state and are accompanied by a compromised or even completely closed upper airway, which is the obstructive event and where it gets its name. These breathing difficulties and hypoxemia often lead to arousals and sleep state fragmentation throughout the night, which causes overcompensatory responses of the autonomic nervous system. These responses are what lead to the body to consistently wake up and be in that fight or flight emotive state, since your body thinks you stop breathing. Some of the symptoms are snoring, which is the most common one. And then another symptom is excessive daytime drowsiness or feeling very sleepy and fatigued, and then low on energy, unmotivated, and feeling unrefreshed despite getting the recommended 7 to 9 hours of sleep. So surface tension is one impact. The surface tension of the liquid lining of the upper airway influences the patency and changes in surface forces, and this can possibly perpetuate disease severity. Patients with OSA appear to have increased surface forces acting on the upper airway. Furthermore, the route of breathing during sleep appears to influence salivary flow, and perhaps as a result may affect surface tension. On the microscopic level, there seems to be many different neurons and neurotransmitters that are involved in OSA. However, there is still much to do in research. And then lastly, slow-wave sleep is one important factor that contributes to the improvement in apnea severity due to the increased upper airway muscle activity. As far as the epidemiology, there is said to be probably around 30 million people with sleep apnea, but only 6% are actually diagnosed. This could be because of stigmas or people just being unaware of it or not taking it seriously, but all of those could influence that. And then also, people most commonly find out that they have this when they first sleep next to someone, so people might not even know. So as far as the risk factors, cardiovascular complications is one of the main ones. These sudden drops in blood oxygen levels that occur during the obstructive patterns increase blood pressure, which strains the cardiovascular system. A lot of people with OSA develop high blood pressure, which then increases the risk of heart disease, heart attack, heart failure, and stroke. Additionally, things like memory loss, depression, asthma, and disturbance to one's partner can all be long-term risk factors. Luckily, there are a lot of treatments. One of the first to prevent it would just be behavioral changes. These could be things such as weight loss, smoking habits, your sleeping routine, and even the position that the patient sleeps in. The position can actually have a really strong influence on your airway pathway. This is because the airway is a collapsible gravitational forces can cause the retropulsion of the tongue and soft palate while laying supine, thus generating increased positive tissue pressure, which ends up narrowing the airway. And then the first line of treatment is CPAP. This is a nasal continuous positive airway pressure in which the upper airway is splinted open to improve patency during sleep. Appropriate regular use of CPAP effectively reduces symptoms of sleepiness and improves the quality of life measures. And it is considered and preferred treatment option for moderate to severe OSA and has a success rate of approximately 75%, which is really great. And then there's also mandibular adjustment devices, which are like you can put them orally and they bring the lower jaw forward, which relieves the airway obstruction. This typically works best for candidates with appropriate definition and mild to moderate sleep apnea. Lastly, there is a surgery, I'm not even going to say the name, but it's just to remove excess tissue. And then lastly, here are my citations. Thank you.